welcome back to my channel. My name is Nurse Kate and I'm your very cardiothoracic nurse. I'm so happy to welcome you to the year 2023. This is my first video in this year 2023 and I'm happy to be sharing this video with you. I wish us all the best in this year. So this year, I'm going to start with reason you must not copy someone else's antihypertensive. You know, as Nigerians, we know so much, even more than our doctors, and we choose to ask questions from people that are actually dealing with the same kind of diseases we are dealing with, such as diabetes. You know, you can choose to ask questions from your friend, your colleagues who is also dealing with diabetes, and you choose to follow the kind of prescription the person is actually on, which is very, very wrong. And I'm going to tell you the reason why they are wrong for people who are actually dealing with antihypertensive. So please don't copy your friend's antihypertensive medication because of all these reasons I'm going to mention. Number one is because of isolated hypertension. Some people have isolated hypertension, and this kind of hypertension are very common in people above age of 60. You see their blood pressure is around 170 or 180, which is the upper one, the systolic, and the lower one will be at the normal range, and that normal range will be 70, 80. And these kind of people are not showing any symptoms of organ damage. There is no headache, there is no eye problem, there is no chest pain, there is no kidney issues. They are doing fine as far as they are on medication. Despite that, the BP will not come down. The one at the top that is very, very high, which is systolic, will not still come down. However, in malignant hypertension, this kind of hypertension is extremely high. Is extremely high, and this kind of hypertension is very, very common in young adults and pregnant women. And this kind of hypertension comes with what we call organ damage. You see, the patient or the person dealing with this kind of hypertension is restless, is confused, and they have to place the person on particular antihypertensive that will control this extremely high blood pressure. The one up and the one down very, very high. The person can be having 200 up and can be having 120 down. And if this kind of hypertension is not taken care of, the person can go into stroke, because the person can start complaining that they cannot feel their arms, they're having headache, they cannot see clearly, they are confused, they are restless, and they kind of person have to get to the hospital. And after checking them, they have to place them on a very strong antihypertensive that will help them to control their blood pressure. You can see the number two reason why you must not copy someone else's antihypertensive. Another type of antihypertensive, another type of hypertension that will make you not to copy your friend drug is because of what we call resistance hypertension. This kind of hypertension, the patient or this person that is dealing with this high blood pressure, we have more than 2 or 3 antihypertensive drug, because the one particular drug will not drop their blood pressure down. Their blood pressure is high, however, it's not extreme and it's not having any organ damage involvement here. So this kind of person might be on like 3, 4 antihypertensive. The doctor might place them on amlodipine, nifedipine, different kind of antihypertensive at the same time. So you don't need to copy that person because your own blood pressure is not of that kind of person that have the resistance. Resistance means that this BP refuses to come down despite the drug the person is on. So the person have to be on, you see them at the same time, they are gathering like 3, 4 drugs at a particular time. So another one is what we call emergency hypertension. This one is very, very dangerous, and it can happen to someone that does not even have hypertension before, or someone that is already dealing with hypertension. The kind of hypertension will go extreme and the person is manifesting organ failure immediately. You see a person complaining of dizziness that you cannot see, you see the person having serious or severe headache, you see the person confused, the person is agitated, the person cannot carry their hands, they are complaining, and the person is not is not taken to the hospital immediately. This person can have what we call hemorrhagic stroke. So this kind of patient have to be taken to the hospital. A very good one for that matter. Then the last one I'm going to talk about is what we call preeclampsia. This one is very, very common and in pregnancy. A lot of women have actually deal with this kind of pregnancy, this kind of hypertension. during their pregnancy period. They don't have hypertension at all even before they got pregnant. So when they got pregnant around 20 weeks of their pregnancy, they start observing a persistent increase. You can see a persistent increase in their blood pressure, and the patient complain of maybe headache, they cannot see clearly, and their legs maybe started swollen. So this kind of patient will be, because of pregnancy, they will be placed on type of antihypertensive that will not affect their baby. So you that you are not pregnant and you have hypertension might not be able to take the kind of antihypertensive they are taking. That is why you don't need to copy your friend's medication. If you have hypertension, please talk to your doctor, go to good hospital where you'll be able to see the doctor, and they can even refer you to people called cardiologists, people that deal with heart, and they will place you on your own medication, because some might even have other diseases. Okay, for example, people that I talked about that have resistant hypertension, this one is very, very common in other people, and also people that are obese, people that have kidney disease, people that have diabetes, normally have this what we call resistant hypertension because of the underlying disease that they are managing, and this will make them to have more or 2 or 3 type of antihypertensive, that they are taking. So you that you don't have diabetes, you don't have kidney disease, and you want to copy their medication, is it not wrong? It is wrong. So please don't do that in this 2020. You don't copy someone else's medication so that it will not complicate your own mild hypertension that you are managing, that can be controlled with your diet, with your activities, with your lifestyle, and exercise. So thank you so much. I hope someone will gain from this video today. Thank you so much for watching my channel. If you are new here, please don't forget to subscribe, and I will see you in the next video. Bye.